Hello everyone, once again welcome back to MMS Makes Medicine Simple. So friends, after fat soluble vitamins, now we are going to talk about water soluble vitamins. And the first vitamin that we are going to study today is vitamin B1, also called thiamine, right? So before we start, I'll request you all, please do subscribe the channel and keep supporting. So now let's start it. So vitamin B1, also called thiamine. The chemical name of vitamin B1 is thiamine. Now see here, very important. This vitamin B1 also called anti-beriberi factor. Why anti-beriberi factor? That we will see in next slide. So apart from anti-beriberi factor, this vitamin B1 is also called antinuretic factor and anurine. Very important. Now see here. It's a colorless basic organic compound composed of sulfated pyrimidine rings. Very important, biochemistry. Now, all living organisms, they use thiamine, that we know, right? But this vitamin B1 is synthesized only in bacteria, fungi and plants, right? Only bacteria, fungi and plants, they can synthesize vitamin B1. Now, it also contains sulfur and nitrogen group, again biochemistry. And very importantly, alkaline and heat, these are the two agents which can destroy vitamin B1. And lastly, the coenzyme form of vitamin B1 is TPP, thiamine pyrophosphate, right? So vitamin B1 thiamine, also called anti-beriberi factor, antinuretic factor and anurine, right? It's a colorless basic organic compound with sulfated pyrimidine rings, and also it is synthesized only by bacteria, fungi and plants, right? Vitamin B1, it contains sulfur and nitrogen group, and alkaline and heat. These are the two agents, they can destroy vitamin B1. And very importantly, the coenzyme form of vitamin B1 is TPP, thiamine pyrophosphate. So with this important note, so now we will talk about the daily requirement of vitamin B1 in different age groups. So now see here, in men the daily requirement of vitamin B1 is 1.3 milligram, right? And which is 1 milligram for women, right? So men, they required 1.3 milligram of vitamin B1 daily, and in women this requirement is 1 milligram, right? Now see here, very important. In pregnant and lactating mothers, the daily requirement of vitamin B1 is 2 milligram, very high. And lastly, in children, the daily requirements of vitamin B1 is 1.1 milligram. So after daily requirements, now we will talk about the functions. So what are the functions of vitamin B1 in our body? So now see here, very important. The first function of vitamin B1 is it's very essential for the converting of carbohydrates into energy, right? So basically vitamin B1 is very important for the carbohydrate metabolism. The second function, the most important use of vitamin B1 thiamine is in the treatment of beriberi. Remember, we have discussed that this vitamin B1 also called anti-beriberi factor, right? So this condition beriberi is caused by the deficiency of thiamine in our diet, right? Now see, the symptoms which are included are swelling, tingling or burning sensation in the hands and feet, right? Confusion and difficult breathing. Now the third function, this vitamin B1 also helps in maintaining the healthy nervous system and healthy mucous membranes, right? Very important. Now, it also helps in the digestion of food and provides strength to our muscles. Not only this, vitamin B1 is very useful for the overall proper functioning, right? So, vitamin B1 is very important for the carbohydrate metabolism, right? Also, the most important use is in the treatment of beriberi, right? And it also helps in maintaining the healthy nervous system and healthy mucous membranes, and also helps in digestion of food and provides strength to our muscles, and very important for the overall well functioning of our body. So after functions of vitamin B1, now we will talk about the vitamin B1 deficiency, right? What are the signs and symptoms of vitamin B1 deficiency? So see here, very important. The most common signs and symptoms of vitamin B1 deficiency are loss of appetite, decrease in food intake, fatigue, rapid heart rate, palpitation, indigestion or constipation due to improper muscle tone in GI tract. Also muscle tenderness, numbness in the arms and legs due to improper nerve functioning, and beriberi, a chronic neurological and cardiovascular disease. Not only this, patients who are deficient with vitamin B1 can also develop a severe condition known as Wernicke-Korsakoff syndrome, which can cause brain abnormalities. Right? Now, patients who are deficient with vitamin B1, they can also present with confusion and amnesia, cognitive decline, and lastly fragile fingernails and dermatitis. Right? So these are the most common signs and symptoms of vitamin B1 deficiency. So after signs and symptoms of vitamin B1 deficiency, now we will talk about the major sources which are rich in vitamin B1. Right? So the major and most common sources which are rich in vitamin B1 that we can take in our diet to replenish the deficient stores. Right? So the sources are egg, chia seeds, sunflower seeds, milk, fortified bread, white beans, sesame seeds, mushroom, spinach, cauliflower, green peas, and lastly tomato. So these are the major sources which are rich in vitamin B1. So in our previous slide we talked about all the major sources of vitamin B1, right? So we can take all those sources to replenish the stores, right? Now what about those patients who are severely deficient with vitamin B1? Right? And also what about those patients who cannot eat all these sources in their diet, right? So to treat all those patients, we need to give them the vitamin B1 in the form of supplements, right? So the supplement thiamine, right? And the dosage are based on the clinical manifestations, right? So see here, for mild polyneuropathy, right? The dosage of thiamine supplement are 10 to 20 milligram once in a day, which should be given for 2 weeks, right? Now see here, for moderate or advanced neuropathy, right, the dosage of vitamin B1 supplement are 20 to 30 milligram per day for several weeks. And lastly, for the people who are developed edema and congestion due to cardiovascular beriberi, right, the recommended dose is 100 milligram intravenous once in a day for several days, right? So in mild polyneuropathy, the recommended thiamine dose is 10 to 20 milligram once in a day for 2 weeks. For moderate or advanced neuropathy, right, the recommended doses are 20 to 30 milligram per day for several weeks. And lastly, in people who develop edema and congestion due to cardiovascular beriberi, the recommended dose is 100 milligram IV once in a day for several days. So thank you so much for listening, and please do subscribe the channel, keep supporting, and also give your important feedback in the comment section. Study a lot, stay safe. Thank you so much guys.